Hi, it's Dr. Rod Story. I thought I'd take a moment to address a unique situation that we don't see too often, a chickenpox outbreak. You probably heard that there is now active chickenpox in our community, and so we're having to make some conversation, or actually have a number of parents that are reaching out to us to ask for advice on what to do about chickenpox, as well as to reevaluate their thoughts on immunization. So first off, let's just review what chickenpox is. Chickenpox is a very contagious virus. It's common in childhood, although we haven't seen it circulating in probably more than a decade. And that's in large part due to vaccination that many families have chosen over time. The interesting thing is through COVID, a fair number of families missed their usual appointments, and that wasn't just in our community, but across the United States. And so the vaccination rates for varicella are quite down. And then COVID has also caused some families to be hesitant about vaccinating. Thirdly, the the varicella vaccine or chickenpox vaccine is an embryonic stem cell based vaccine, and there are families that are morally opposed to that, or at least have used that to pause the conversation as to, is this even necessary and good? If you're like me, you had chickenpox when you were a kid, and you remember chickenpox as a very mild illness. You're sick for a couple of days, the usual rash, putting all that pink calamine on your skin, and then eventually it healed. And for many people, that is the usual experience. It was one of many common childhood illnesses that have been present through all of history. Now that we're people getting the vaccine, we rarely have the experience of remembering some of the downsides of chickenpox. Chickenpox itself is a respiratory illness. It's very, very contagious. It's passed by breathing, similar to flu virus or other cold viruses, and it is highly contagious. It has a longer incubation time, so it takes a little bit for an exposure to turn into something. There is some contagiousness to the open blisters and sores that come with it, or the little fluid-filled blisters that people get with it. Chickenpox is also unique in that it is a virus that we think lives in you the rest of your life once you get it. So for many people, their experience of chickenpox is to get it again as shingles later on in life, which can be a very painful and debilitating circumstance. And for which we think vaccination reduces the likelihood of carrying it or having shingles later on in life. What we may not remember, or what we get the conversation about from parents is, well, didn't we used to do chickenpox parties when we were kids? And really, that was a common consideration, partly because we know that getting chickenpox during younger years, during the school age, tends to be a much more mild illness, versus kids who might not get it at that point, but get it as teenagers or as adults for the first time. And that actually creates some problems. It's a much more severe illness. It creates oftentimes scarring from the severity of it. It can be associated with neurologic injuries at an older age. And it's also one of the main risk factors for pregnancy. So a pregnant mom who might get chickenpox, who doesn't have vaccination or may not have experienced chickenpox naturally, is actually at very high risk of being very sick if they were to get chickenpox, and of injuring their unborn child. On the other end, again, is the children, and one of the reasons that people have been kind of leaning towards vaccination for chickenpox over time is that it was a common reason for young kids to be hospitalized. There's some unique things that, as people have the COVID experience and have the idea of long COVID or leftover viral injury from having had an illness, that's common on many viruses, including chickenpox. So with chickenpox, we would occasionally see in about 1 out of 600 patients in kids this weird imbalance issue where they're basically dizzy and unsteady for several months, and then it wonderfully goes away, but it can take some time. It can be very slow to do that. We also would occasionally see kids get very, very sick with it, even to the point of having a certain kind of meningitis, or what is better called encephalitis, causing a brain inflammation and sometimes some long-term problems afterwards. And chickenpox was one of the more common reasons that kids, particularly under the age of 2, were hospitalized with a pneumonia. Interestingly enough, many people, again, don't think of chickenpox as a chest illness or a viral cold, but it is a flu-like illness that can cause a lot of inflammation in the lungs, particularly in younger kids. Well, hope that kind of gives you a sense of what we're talking about. A number of families are reaching out to us, and we do carry the chickenpox vaccine for people to consider. We don't ever require people to get it in our practice, but we're glad to answer some questions. We would encourage you to look at our website and to kind of get some in-depth information, even including a discussion about embryonic stem cells and the ethical problems that raises. Our goal in talking about that is to encourage people to be thoughtful, to be aware, and then we would love to see alternatives in the marketplace. We would love to see more vaccination available that is not embryonic stem cells, so that doesn't continue to be a problem. And as always, we're glad to take time as our physicians here to know and answer questions with our members and to help you walk this through. Thanks again. This is Dr. Rod Story.